President Trump warning Republicans who refuse to pass his budget bill they will pay a political price if they don't show support.
The president met with GOP lawmakers behind closed doors today. He wants the bill passed by Memorial Day. Your political reporter Sean Boyd joining us now live in studio.
Sean, of course, Medicaid, one of the big sticking points here.
And some GOP hardliners want deeper cuts to Medicaid and are threatening to derail this bill if they don't get their way. It's estimated the measure would raise the national debt by just over $3 trillion over the next 10 years, despite a $700 billion reduction in Medicaid spending, including the elimination of programs that have helped reduce opioid deaths in Colorado by 35% and were championed by a Colorado lawmaker.
Mom overdosed 20 times that year.
For Congresswoman Brittany Pettersen, the debate over Medicaid isn't political, it's personal. If not for Medicaid, she says, her mom wouldn't be alive. She struggled with opioid addiction for years, a struggle that would become the catalyst for far-reaching legislation, including a law that expanded Medicaid to cover inpatient treatment for substance use disorders.
When you're denying them care and turning them in and out of the ER, the federal and state government spent over $1 million keeping her alive in the ICU instead of giving her access to the care that she needed.
Pettersen was working on the bill with stakeholders, including emergency room doctor Don Stater, when her mom overdosed. Stater was on duty.
It was one of the most surreal moments and patience of my life. And it made, again, just so clear what we were fighting for and what the stakes are.
With Stater's help, Pettersen has passed a number of transformative laws to help those like her mom, who is now 8 years in recovery. But she says the Republican budget bill puts all their progress at risk.
My mom's an exact example of what's possible when we give people the help they need. All of this is going away with this bill.
The bill strips Medicaid funding for inpatient addiction treatment, repeals a law providing naloxone for rural first responders, creates work requirements and cost-sharing provisions for recipients, along with twice-yearly eligibility reviews.
It's created to purge people off of actually qualifying for these benefits while paying tens of millions of dollars by increasing bureaucracy.
In Colorado, it's estimated the administrative burden alone would cost up to $57 million, and more than 100,000 people could lose coverage.
We are going to take our healthcare back a quantum leap to something that is far less effective, far less compassionate, and far less efficient than what we have now.
We had the biggest reduction of overdose deaths, and it's because of this work. It's because of access to naloxone. It's because of increasing access to treatment. And they're actually taking that option away for states like Colorado.
Nearly 48,000 Medicaid recipients in Colorado were treated for substance use disorders last year alone. If the budget bill passes, the only way to make up funding for inpatient treatment would be to cut other services. The legislature has passed about 30 bills over the last 5 years that expand Medicaid coverage for a variety of services. House Republicans can only afford to lose a few votes if they want to pass this bill. And then it also has an uphill battle in the Senate, too, with Republicans.
They'll be working overnight tonight. We'll see what happens tomorrow morning.
Be working right on through the weekend,
yeah,
probably.
That's right. Thank you, Sean.